Yeah. Okay. Hello and welcome to Outline. Coming up are the headlines for today. China gives COVID-19 vaccines for its community in Oman. Omantel donates 100,000 Omani riyals for maintenance of 21 houses. 3 expats arrested for smuggling drugs into Oman. Those are the headlines for today. Now for the weather facts. Fog, as we know, is made up of tiny water droplets, or in very cold conditions, even ice crystals. When seen on a high-speed camera, it looks like hundreds of small water droplets moving through the air. That was our fact for today. Now let's take a look at the weather update from Oman Meteorology and Civil Aviation Authority. An alert has been issued indicating reduced visibility during blowing dust, thunder showers and fog formation. Apart from that, we've got mainly clear skies over most of the Sultanate, with chances of cloud formation over the Al Hajar mountains, which may result in isolated rain towards the afternoon. There are also chances of dust rising winds over the deserts and open areas of Al Buraimi and Al Zahira governorates. There is also a possibility of late night to early morning low-level clouds along parts of the coastal areas of Arabian Sea and the Oman Sea. With that, let's take a look at what the weather will be like throughout the Sultanate. Muscat will be sunny with temperatures between 27 degrees Celsius and 40 degrees Celsius. Musandam will be sunny with temperatures between 30 and 41 degrees Celsius. North Al-Batana will be partly cloudy with temperatures between 26 and 34 degrees Celsius, and South Al-Batana will be sunny with temperatures between 27 and 38 degrees Celsius. Al Buraimi will be sunny with temperatures between 28 and 44 degrees Celsius. Al Zahira will be sunny with temperatures between 28 and 44 degrees Celsius. Al Dakhla will be partly cloudy with temperatures between 29 and 42 degrees Celsius. North Al-Sharqiya will be sunny with temperatures between 28 and 42 degrees Celsius, and South Al-Sharqiya will be partly cloudy with temperatures between 29 and 39 degrees Celsius. Al-Wusta will be sunny with temperatures between 26 and 46 degrees Celsius, and Dhofar will be sunny with temperatures between 26 and 33 degrees Celsius. Welcome back to Outline. Let's take a look at the local stories for the day. The Chinese government has provided COVID-19 vaccines for its community in Oman. A statement issued online by Ministry of Health said the following. As part of bilateral relations and cooperation between the Sultanate and the People's Republic of China, Oman received today a batch of COVID-19 vaccine called Sinovac provided by China. The Chinese community living in the Sultanate has the priority to take the vaccine. Emerge would like to thank the friendly Chinese embassy represented by the ambassador for the valuable cooperation in the health field since the beginning of the pandemic, the statement added. Within the partnership between Oman Telecommunications Company or Omantel and Dar Al Ata Association, Omantel has contributed 100,000 Omani riyals approximately for the maintenance of 21 houses in the various governorates for the current year. The donation came within the Dar Al Ata Family Welfare Program, a portion of which will go towards maintenance of homes. This is the 7th year wherein Omantel has supported the maintenance of houses since 2014. The total financial support is estimated at over 500,000 Omani riyals for maintenance of 152 houses out of 650 houses for which Dar Al Ata has so far provided maintenance. I appreciate and value the long-term partnership we have established with Omantel, said Mariam bint Isa al-Zajali, chairperson of Dar Al Ata Association. She added that Omantel is one of the key supporting companies and the first to embrace the initiative to support the maintenance of houses of the association, and said that the maintenance of houses is one of the sustainable projects. The partnership with Omantel is focused on distribution of maintenance works to cover the various governorates of the Sultanate in cooperation with the social development committees in the governorates. We have also relied on awarding tenders to local small and medium enterprises or SMEs, she added. Omantel's Corporate Social Responsibility Manager Laila bint Mohammed Al-Wahebi said the following. Omantel's contribution comes within the corporate social responsibility of the company through the allocation of part of its social initiatives for the maintenance of houses. The initiative for maintenance of houses is announced every year during the month of Ramadan and is supportive to Dar al-Atha's efforts to this effect and for the enhancement of partnership with the various institutions. Omantel is keen for investment in sustainable social projects with direct impact on individuals of the society. 3 expats have been arrested by the Royal Oman Police for attempting to smuggle narcotics into Oman. A statement issued online by ROP said the following. The General Administration for Combating Narcotic Drugs and Psychotropic Substances, in cooperation with the Coast Guard Police, arrested 3 expatriates while they were smuggling narcotic drugs into the Sultanate. Seized from their possession were 50 moles of crystal drug and 20 moles of hashish. The legal procedures are being completed against them. And now in some COVID-19 news, the Ministry of Health has registered 13 new deaths due to COVID-19, taking the total death toll to 2,206. The ministry has extended its deepest condolences to the families of the deceased. The Ministry of Health has also announced the registration of 796 new COVID-19 cases. The total number of cases in the Sultanate now stand at 206,297. There have been 723 recoveries in the past 24 hours, taking the total number of recoveries to 191,065. The ministry has urged everyone to adhere to social distancing instructions issued by the Supreme Committee and the Ministry of Health. Now for more COVID-19 updates, let's join Madiha Asif in the Fighting COVID studio.
Thank you, Andra, for the updates and welcome to Fighting COVID. First of all, congratulations on finally bringing the coronavirus cases number down in the Sultanate last week. As you all know that no announcements were made during the Eid period of coronavirus cases in the Sultanate from Tuesday to Saturday. And just yesterday, the Ministry of Health announced the cumulative number that was recorded during Tuesday and Saturday, standing at 2,788. So if you look at the breakdown, on Tuesday, 702 cases were reported. On Wednesday, 675 cases were reported. On Thursday, 540 cases. On Friday, 283 cases. And lastly, on Saturday, 588 cases were reporting, proving the effectiveness of the lockdown that was placed by the relevant authorities in the country, as well as adherence to the precautionary measures by the public. Now let's see how it goes from here since the lockdown in the Sultanate has been lifted. Now pointing out to a significant fall in the coronavirus infection and the patients in the region, a social activist and data analyst said that the recovery rate has reached 92.6%, while the number of patients in intensive care units has declined by 20 since the beginning of May 2021. Now, speaking exclusively to Times of Oman, Ibrahim Al-Maimani, who's a social activist and analyst, said that we know that the number of daily infections during the Eid al-Fitr holiday decreased as 2,788 cases were recorded, while the average daily number falling by 225 a day from 783 to 588 new cases on May 11th. Meanwhile, recoveries increased, and for a period of 5 days, the total amounted to 3,951, with an average of 790 cures per day. Now, despite the increase in recovery rate, which is standing at 92.6%, Maimani noted that the death cases were still high, as 45 deaths were recorded in the past 5 days, which means 9 death cases was an average for per day, and he said that it is all because of the cases that are admitted in intensive care units in the Sultanate. As for the hospitalized patients, Al-Maimani pointed out that a decrease of 111 cases was noticed since the beginning of May, that is 13% of a total of 722 cases recorded. The number of ICU cases fell by 20 since the beginning of May, which is 7% of the 255 such cases recorded. Furthermore, to contain the situation of the pandemic in the Sultanate, I'm sure you all would remember that the authorities in the country banned flights coming from several countries, and then it further extended the ban earlier this month. The entry of travelers from Sudan, Lebanon, South Africa, Brazil, Nigeria, Tanzania, Ghana, Guinea, Sierra Leone, Ethiopia, the United Kingdom, India, Pakistan and Bangladesh, as well as those from any other country if they visited the above mentioned countries within 14 days from applying to enter the Sultanate till further notice. In addition, it also added incoming travelers from Egypt and the Philippines to the list of travel ban countries, as well as travelers from any other country if they visited these two countries within 14 days from applying to enter the Sultanate, which came into effect starting from May 9th. Now, having said that, and on an extremely sad note, the first Omani health worker, a nurse named Shanuna Al-Nomani, lost her life last week as a result of coronavirus in the country. In fact, a statement was issued by the Ministry of Health offering condolences on behalf of the Minister of Health, Dr. Ahmed Al-Saidi, and other respected excellencies to the family of the late. Furthermore, in terms of vaccinations, the authorities in the Sultanate are constantly reminding and sending messages to the public, asking them not to fall prey to the rumors that is being circulated on social media platforms regarding the vaccine shots. In fact, the director of the Department of Disease Surveillance and Control at the Directorate General of Health Services in Muscat Governorate has urged people not to circulate rumors and unauthorized news about vaccines. The Directorate General of Health Services in the Governorate of Muscat is making continuous efforts to complete the vaccination operations and take vaccines against coronavirus. At a time it seeks to strike a balance with the primary health services it provides and to enhance awareness of the importance of social distancing and wearing masks to prevent and limit the spread of the epidemic. In addition to that, a scientist in Germany says that he has found an answer to the question of why some COVID-19 vaccines trigger rare clots as researchers around the world examine AstraZeneca and Johnson & Johnson shots. We'll be talking about in detail about what he says after this quick commercial break. Welcome back to TTV. You're watching Fighting COVID. Now, before going on this quick commercial break, I told you that a German scientist claims that he has found an answer to the ongoing question of why some COVID-19 vaccines trigger rare blood clots. And according to an article published by Bojan in the Wall Street Journal on May 13, scientists around the world are racing to understand why COVID-19 vaccine jabs by AstraZeneca and Johnson & Johnson are causing rare but potentially deadly blood clots. Now, determining the connection would help patients, doctors and health agencies better assess any risks posed by the vaccines and safely calibrate their use. He wrote that in recent weeks, the US, the Canadian province of Ontario, and several European countries including Norway and Denmark, either paused or completely halted rollouts involving these vaccines. For this article, he got the opportunity to interview Eric van Gorp, a professor at Erasmus University in the Netherlands, who heads a group of scientists studying the condition, and he said that understanding the cause is of highest importance for the next generation vaccines because the novel coronavirus will stay with us and vaccination will likely become seasonal. Now, Bojan, in his piece of article, mentioned that in Germany, one researcher thinks he has found what is triggering the clots. Going by the name Andreas Greinicher, a blood expert, and his team at the University of Greifswald believe so-called viral vector vaccines, which use modified harmless cold viruses known as adenoviruses to convey genetic material into vaccine recipients to fight the coronavirus, could cause an autoimmune response that leads to blood clots. According to Professor Greinicher, that reaction could be tied to stray proteins and a preservative he has found in the AstraZeneca vaccine, Bojan wrote in his article. Another very interesting thing, he pointed out that Professor Greinicher and his team has just begun examining Johnson & Johnson's vaccine, but has identified more than 1,000 proteins in AstraZeneca's vaccine derived from human cells, as well as a preservative known as EDTA, or also commonly known as ETA. Their hypothesis is that EDTA, which is common to drugs and other products, helps those patients stray into the bloodstream where they bind to a blood component called platelet factor 4 or PF4, forming complexes that activate the production of antibodies. The inflammation caused by the vaccines combined with the PF4 complexes could trick the immune system into believing the body had been infected by bacteria, triggering an archaic defense mechanism that then runs out of control and causes clotting and bleeding, wrote Bojan in his piece of article. Now, Professor John Kelton of McMaster University in Canada, whose outfit runs Canada's reference lab for testing patients with blood clotting symptoms after vaccination, said the lab replicated some of Professor Greinicher's research and confirmed his findings, yet the cause was unclear. In terms of the clotting, it has been observed that this kind of clotting is known as vaccine-induced immune thrombotic thrombocytopenia, or commonly known as VITT. Most of the science hubs investigating the clotting issue, first identified in March, are experts in a condition called heparin-induced thrombocytopenia, or HIT, which has near identical symptoms and outcomes to VITT. With HIT, the blood-thinning drug heparin causes clots paired with an abnormal decrease in the blood's natural clotting agents. Now, clotting occurs between 1 in 28,000 and 1 in 100,000, according to European data, extremely rare amid the hundreds of millions of doses administered so far, yet higher than 1 in 150,000 previously assumed by some medical authorities. Professor Greinicher said, most of the hundreds of people who have been diagnosed recover, but between a fifth and a third have died, and others could suffer permanent consequences. Now, data from US and European regulators suggest that young women are primarily affected by this condition. With this, we have come to the end of the episode for Fighting COVID with me, but let's get back to Antara.
That was Madiha Asif with the latest COVID-19 updates. We'll be back tomorrow with midday updates, so stay tuned and keep watching TTV.
You've just heard the live feed from the TTV studios on TFM 95.4. Let's talk.